This presentation is going to focus on risk factors for heart disease. It is very important to modify your risk factors to reduce your risk of further heart problems. It is also important to remember that risk factors are cumulative. The more risk factors you have, the more at risk you are of developing heart disease. The following is a list of the risk factors we will go on to discuss in more detail. Smoking is considered to be the highest modifiable risk factor. It is extremely harmful to the heart. It raises the blood pressure and makes the blood a lot thicker. It can cause furring up of the arteries, also known as atherosclerosis. Carbon monoxide in tobacco starves your body and your heart of oxygen. Nicotine in cigarettes increases the heart rate. Your diet plays a crucial role in the prevention of heart disease. Try to eat 3 regular meals per day. Try to eat more oily fish, for example, mackerel, salmon, sardines or herring. Eat less salt, but avoid salt alternatives. Eat more fruit and vegetables and aim at least 5 portions per day. Try to eat more starchy foods and try some whole grain varieties. Too many saturated fats can be linked to high cholesterol, which can lead to the development of heart disease. Reduce saturated fat intake, often hidden in cakes, pastries, processed foods and takeaways. Take medication regularly. Aim to keep your cholesterol below 4 and aim to have regular checks, 12 monthly, which your GP should organise. Maintaining a healthy weight helps to reduce your risk of heart and circulatory diseases. It helps prevent and manage conditions like high blood pressure, high cholesterol and type 2 diabetes. Even if you don't have any of these conditions, it's important to keep a healthy weight so you don't develop them in the future. Eating well and being physically active can help you manage your weight and keep your heart healthy. Family history is considered to be a non-modifiable risk factor. Research suggests that there is a strong genetic link, as with some other medical conditions. You're more at risk of developing heart disease if your father or brother developed heart disease under the age of 55 or your mother or sister was under 65 when they were diagnosed. A sedentary lifestyle can be considered a risk factor towards the development of heart disease. Try to plan some regular exercise into your week. Aim to do 30 minutes 5 times a week. And if you're able to, exercise also helps you to maintain a healthy weight and helps to stabilise cholesterol and blood sugar. Exercise also helps to improve blood pressure and heart function. High blood pressure is termed as hypertension. This can lead to damage within the endothelium, which is the inside of the artery wall. This can then put you at increased risk of further heart problems. It is important to have regular checks and to take your medication as prescribed. Your blood pressure target is to have a blood pressure of less than 140/90, and 1 in 4 adults in the UK have high blood pressure. However, it is important to remember that many things can impact on blood pressure recordings. For example, if you're in pain, anxious, or simply seeing a doctor. This is known as white coat hypertension. Your healthcare practitioner may request a 24-hour blood pressure monitor so we can gauge an average record over a longer period. Diabetes is caused by having too much glucose in your system, which can damage your arteries. This damage makes it easier for fatty deposits to build up, which can lead to coronary artery disease. Insulin is a hormone that controls your blood sugar levels. There are 2 types of diabetes. In type 1, your body does not make insulin or cannot use the insulin it makes. 1 in 10 people with diabetes are type 1, and children and young adults are more likely to be diagnosed with type 1. In type 2 diabetes, your body doesn't make enough insulin or cannot use the insulin it makes. 9 out of 10 patients with diabetes have type 2, and people are more likely to develop this as they get older. It is also important to take medication as prescribed and to modify the diet accordingly. You should have an annual checkup to monitor your glucose control. Type 2 diabetics can reduce their risk of heart disease by making simple changes. This will include losing weight, especially if you carry it around your middle. Swap foods that are high in fat and sugar for healthier alternatives. Stress can lead to habits that aren't good for your heart health. For example, increased smoking, drinking more alcohol, exercising less, and adapting poor eating habits. What may seem like small actions can add up to long-term health problems. Try to focus on things you can control. Don't be afraid to ask for help if you feel that you need it, and let people in your life know how you're feeling. There are services available. Talk to your GP about Trent Psychological Therapy Services, or email www.trentpts.co.uk or call Derby 01 332 411 260. Cholesterol is a fatty substance in our blood, produced naturally in the liver. Everyone has cholesterol, and we need it to stay healthy as every cell in our body uses it. High cholesterol can be caused by many different factors, and there are factors we can't control. For example, getting older, ethnic background, and our family history. But the factors we can control are eating a lot of saturated fats, smoking, not being active enough, and having too much body fat, especially around your middle. Drinking too much alcohol puts you at risk of developing coronary heart disease as it increases your blood pressure, which can damage your artery wall. This makes it easier for fatty deposits to build up. It is important to keep within the recommended alcohol guidelines, and men and women should not drink more than 14 units per week, and this may be lower depending on your cardiac condition. But what is a unit? 14 units is equivalent to 6 pints of 4% beer, 6 glasses if the glasses is 175ml, and that's of 13% alcohol by volume wine, or 14 25ml measures of a spirit of 40%. Try to have some alcohol-free days each week. Binge drinking is when you have more than 6 units in one session. If you feel your drinking may be an issue, you may want to discuss this with your GP or healthcare provider for help or advice.